I actually had two here. The first one was in August of this last year. I had a bad hip replacement, and the main prosthesis that goes into the thigh bone was loose, and it caused me pain for quite a number of years. And here I am 6 months later, and thank God I'm here, and I'm feeling much better. I first heard about it when they put them on me in the hospital. When the representative came over to me and explained what they were doing, and we hooked them on, and they fired them up, and they did what they were supposed to do. When I had my first surgery, I wore the stockings, and they were fairly uncomfortable. And I don't believe they're really effective in either. I mean, this is much more active. The product felt comforting, knowing that it was being active. It was periodically squeezing and then letting go. And as long as that was going on, I felt that I didn't have to worry about any thrombosis. So that was good. As a patient, the benefits of the product are pretty apparent if you know what they do. If you know that you have something on that is going to help protect you from dying of a thrombosis, which will go to your brain or to your lungs, then you know it's for a good reason. That's a big benefit. Indeed, when I eventually stopped wearing them, according to the doctor's orders, I was a little concerned. You know, I got used to wearing them and knowing that I was protected. Especially the fact right after surgery, I was down and out for a number of weeks, and indeed had to continue to take intravenous antibiotics, which I had to give myself. And I was not feeling well for a long period of time. And when I was wearing those things, I felt like I was doing something for myself. After the surgery, they do want to get you up, and they do get you up pretty quickly. And I wanted to get up pretty quickly too. Yes, yeah, I'd had the device on. If I recall, the only time that I had the device off was when I was taking a PT for physical therapy. I did not need any care from a nurse or anyone else with respect to the device. It was kind of a no-brainer. Once you put them on, they were on. They did what they were supposed to do. And that was pretty much it. Yes, yeah, I was carrying the device with me in the hospital when I had to get up. Wherever I went, my little friend went with me. My experience with the device at home was very much like what I had in the hospital, except I was much more mobile at home. Sleep-wise, as I noted before, it was, yeah, I think it helped me sleep and took my mind off the pain. I tried to be very active with those, as active as I could be. And I was okay. I was okay. You know, going up the stairs, going down the stairs, doing what I have to do. You learn how to do things. So I did feel safer. There's no question about it. Yeah. And I felt comfortable enough with the device so that, you know, as I noted before, I actually barbecued salmon wearing the device. As a matter of fact, my partner, she took a picture of me doing it. She thought it was kind of funny. No. With ActiveCare treatment, there was no risk of related to blood thinners. I mean, blood thinners do exactly that. And if it doesn't clot, you bleed. And you need to have the clotting occur. And there were a few times when I was on blood thinners where I cut myself, and it took a while to stop, and I didn't like that fact. God forbid if something were to happen to me, if I had a major accident, I'd bleed out. And, or it would be much more difficult for emergency personnel to take care of me. So, no, I was aware of it. I don't like those. I just don't like those things at all. I mean, if you can do the same thing and not carry any risks whatsoever, hell yeah. Sorry. Yeah, absolutely. In prior surgeries, they would put those stockings on you, and you wear the stockings, and it's supposed to do sort of the same thing. But the stockings were annoying. I don't believe they really did anything except constrict your blood flow, as opposed to having a healthy blood flow, which the product does. Yeah, I think hospitals should use the product. I mean, I usually don't give testimonials about any products whatsoever. But it worked, and it's simple. So why not? Overall, was I satisfied with the treatment, with your treatment, the ActiveCare treatment? Yes, I was. Yeah. I mean, I'm sitting here, aren't I? I'm alive. I didn't have any thrombosis. And that's a risk, so I guess they worked. Well, I remember when I was in the hospital, your representative came and showed me about the product, told me about it, and put me on them. And he explained what they were for, and the delivery, he was quite effective and efficient. Very friendly, which was good, because I needed all the friends I could at the time. And he walked me through it, told me what to do, and told me that I can't remember the number of weeks, I would be contacted again, and that your folks would pick up the device when I was done with them. And indeed, that's what happened. There were no questions, there were no issues. As a matter of fact, I was a little late in returning the product, and the representative called me and said, "Could you please put them in the mail," or whatever it was, to FedEx, which didn't cost me anything, by the way, so that you could give them to another patient. And I was very apologetic, and indeed dropped them off. But everybody was, your folks were friendly. They were patient, which is important when somebody's not hitting on all their cylinders, and I wasn't. So it was good. It was a good experience. Nobody barked at me or made me feel uncomfortable or stupid, which you never make me feel stupid. It's not going to work. But it was a good experience. It was a good experience out of the generally bad experience I had. Yeah.